Dear colleagues, welcome to the second Neauvia piece, where the topics it will be the lips. The lips are an essential component of the symmetry and aesthetics of the face. Thanks to the introduction of fillers, the mini-invasive cosmetic correction to modify the lips has recently gained in popularity, but the results are, in some cases, not so good. In this small pill, we will describe the features of the ideal lips for an individual's face in respect to the facial anatomy. In the same time, we will touch the anatomical landmarks of the face, the facial proportion of the lips, and ethnic and sexual differences. So, follow us and good pill to everyone. We start to tell that the face is divided into horizontal thirds. The upper third extends from the eyeline to the glabella, the middle third from the glabella to the subnasal, and the lower third from the subnasal to the menton. These facial thirds are rarely equal in size. In Caucasians, the middle third is often smaller than the upper third, and the middle and upper third are smaller than the lower third. In East Asians, the middle third of the face is often larger than the upper third and equal to the lower third, and the upper third is smaller than the lower third. The golden ratio, also known as the divine proportion, is considered by many to be the key of the mastery of the aesthetic attraction and human beauty. I don't know if it is completely true, and it is sure that 1 to 1.618 is a proportion that we can find also in a lot of face anatomy proportion. The width of the mouth is phi times the width of the nose. The distance between the lateral canthi is phi times the width of the mouth. The volume and therefore the vertical height of the vermilion of the upper and lower lips should ideally fit within the golden ratio or divine proportion, that is yielding the value of phi, exactly 1 to 1.618. The vertical height of the upper lips should be less than the lower lip. Females will often request augmentation of the upper lips alone without considering the balance between the upper and lower lips. Thus, it is incumbent upon the physician to educate the patient regarding the ideal ratio. Sausages or duck lips do not merely occur from overcorrection, but also from a poor understanding of the delicate contours of the normal lip anatomy. On lateral view, if a straight line is drawn from the subnasium to the pogonium, the upper lip should project 3.5 mm anterior to the line, and the lower lip 2.2 mm. The upper lip should project slightly more than the lower lip, again about 1.6 to 1. An exaggeration of these proportions or the wrong ratio can lead to a duck-like or throat-put appearance. Under no circumstance should the lips enter the room before the individual. To summarize in simple mode what I said so far, I report to you some very simple numbers that we can use to manage our lips correction in the best mode. The distance between the nose and upper lips could be around 18-20 mm. The distance between the chin and the lower lip could be around 36-40 mm. The relationship between the upper lip and the lower lip is usually about 1 to 1.618. The fundamental proportion of the lips change as a person ages, with lengthening of the cutaneous portion of the upper lip and volume loss and thinning of the upper lip vermilion. Gravity, osteoporosis, dental changes, maxillomandibular bone resorption, and further soft tissue volume loss at the oral commissures cause the commissure to turn downwards in a perpetual sad aspect. While aging Caucasian males and females have similar hard and soft tissue volume loss, with thinning of the vermilion and cutaneous portion of the lips, males generally do not develop wrinkles of the upper and lower lips. This is because their skin is thicker, with more subcutaneous fat surrounding the terminal hair follicles, as opposite to the fine vellus hair in females. The hair follicle have a supportive behavior for the skin. Naturally, there are racial and gender difference in the dimension of the lip, but this is another story that requires more time. When we start to inject fillers in the lips anatomic space to avoid any iatrogenic, compressive, or occlusive complication, it is important to remember the anatomy of this area. Two important arteries are present in the lips body: superior and inferior labial arteries. The superior labial artery runs along the mucosal border of the upper lip. The inferior labial artery travels horizontally along the alveolar border of the mandible beneath the labiomental fold. The superior labial artery is larger and more tortuous than the inferior. It follows a similar course along the edge of the upper lip, lying between the mucous membrane and the orbicularis oris, and anastomosis with the artery of the opposite side. It supplies the upper lip. The mean diameter of the superior labial artery is around 1.3–1.4 millimeter. The distance of the superior labial artery from the anterior border of the red lip is around 7 millimeter, and from the posterior border around 3 millimeter. The depth of the superior labial artery measured from the skin is around 5 millimeter, from oral mucosa is around 3 millimeter, and from the lower margin of the upper lip is around 6 millimeter. The inferior labial artery arises near the angle of the mouth. It passes upward and forward beneath the triangularis and penetrating the orbicularis oris, runs in the tortuous course along the edge of the lower lip between the muscle and the mucous membrane. It supplies the labial glands, the mucous membrane, and the muscle of the lower lip, and anastomized with the artery of the opposite side and with the mental branch of the inferior alveolar artery. The mean diameter of the inferior labial artery is around 1.2–1.3 millimeter. The inferior labial artery courses over the alveolar margin of the mandible, which is far from the vermilion of the lower lip, before giving off ascending branches to the vermilion. The average depth of the inferior labial artery, which travels along the inferior border of the oral vestibule, from the skin and the oral mucosal reflection are 5 and 4 mm respectively. Filler injection depth varied from more superficial, dermal or mucosal, to the deeper layers at the junction of the orbicularis oris muscle with the cutaneous skin, red lip mucosa, and minor salivary glands depending on the segment of the lip. Lamina propria and submucosa represent a soft, flexible structure, sliding, extensible, and easily movable. The projection can be created also by injecting the filler below the muscle. Neauvia offers a specific line of filler for the different anatomical layer correction, but all products are created with the smart cross-linking technology, with PEG as cross-linker. Inside of our wheel, in the red central area, you can see the properties of the smart X-linking technology. In the gray lateral portion, the benefit, and the outside of the wheel, all the clinical outcomes. In this specific anatomic area, the control of the mechanical properties and the hygroscopic behavior represent the most important practical plus of the technology. For genetically thin lips, structural augmentation with a deeper placed filler followed by volume correction with a superficial filler is ideal. For pure cosmetic enchangement of lips, a superficially placed filler with emphasis on the white roll and expansion of the vermilion is ideal. This is the product that I usually use for the lips correction. 24 mg of AHA, of hyaluronic acid, PEG cross-linked with glycine and proline for a better swelling control. Some words about the anesthesiological procedure. The infraorbital nerves block is often used to accomplish regional anesthesia of the face. The procedure offers several advantages over the local tissue infiltration. A nerve block often achieves anesthesia with a smaller amount of drug than is required for local infiltration. In addition, unlike local tissue infiltration, nerve blocks can provide anesthesia without causing tissue distortion. Before treatment, local nerve blocks were administered with 1% lidocaine without epinephrine to shorten the duration of anesthesia after treatment. Infraorbital nerve blocks were given for the upper lip and mental nerve blocks for the lower lip. In general, regional anesthesia is ideal when the area of interest is innervated by a single superficial nerve. The infraorbital nerve supplies sensory innervation of the lower eyelid, the side of the nose, and the upper lip. A successful infraorbital nerve block provides anesthesia for the area between the lower eyelid and the upper lip, as you can see in the image on the right. The mental nerve is a branch of the inferior alveolar nerve that exits via the mental foramen and divides in 3 branches below the depressor angular oris muscle. One branch supplies the skin of the chin, and the other 2 innervate the skin and mucosa membrane of the lower lip. Note that this nerve block does not provide anesthesia to the teeth or mandibular soft tissue. Treatment of the lips is performed to improve their contour, to increase their volume, to treat all the fine wrinkles called barcode. Regarding the contour improving, the technique consists in infiltrating the lips on the edge between the white part and the red part along the wool profile, as you can see in the image of the slide. The total volume could be around 0.5 to 1 millimeter. For the vermilion push-up filling, we can use a fan technique. The drag is administered without removing the needle, tuning it at an acute angle. That is, lines like a fan begin to diverge from one point. In this case, we can inject 0.05 ml for each injection or each line, and the total volume of substance used is again around 1 milliliter. Parisian lip augmentation technique. Injections are carried out vertically. Thanks to this, the filler falls into the central part. The lips are swollen like a child without too much vulgarity. For the cupid arch lifting, we can inject low quantity of HA few millimeters below the cupid's bow, exactly in the vermilion. Depth of the injection 3 millimeter to 3 millimeter. Volume of the bolus is around 0.05 to 0.1 milliliter, and is not required hot massage. Bolus augmentation technique. The tubercles of the upper and lower lips are natural areas of prominence that should be unchanged during the lip augmentation. Small amount of product in the tuberculous point can induce a great lip projection. So again, 0.05 to 0.1 ml for each injection point. Total volume of substance used around 0.4 to 0.6 ml. Also in this case, no hard massage is required. I consider this article one of the most interesting for the global correction of the lips. In six steps, the author describes the correction of philtrum columns, cupid's bow, and the white roll using very low quantity of hyaluronic acid. In the same time, with other 3 steps, describe how to create pillows and pillars, working with microbolus of HA to promote the best volumization of the lips. And now we will speak about side effect, common and uncommon complication. Common side effects of hyaluronic acid fillers are temporary and should only last a few days. They may include bleeding from the injection site, swelling and bruising, redness and tenderness at the site of the injection, and sometimes we can have a reactivation of the herpes simplex of the lips or of the area surrounding the lips. More serious side effects are the uncommon complications, and they may include severe and prolonged swelling or bruising lasting 1 week to 10 days, lip asymmetry, or lumps and irregularities in the lips, as you can see in the image in the slide. Sometimes we can have infection, and unfortunately, rare, but sometimes we can have also injection into blood vessels. Embolia cutis medicamentosa is reported not only for supraorbital angular artery but also for labial artery. The signs symptoms in this case are intense immediate pain that may be masked because of anesthesia and blanching. Skin changes progress predictably to the appearance of purplish red mutting and then hemorrhagic blisters, ultimately necrosis and scarring. In case of so severe complication, we have in our hands an efficacy emergency kit composed by hyaluronidase, nitroglycerin paste or patch, aspirin, warm compress, and hard massage to spread the hyaluronidase infiltration in the affected area. And now some clinical case before and after the injection with no more than 1 milliliter of Neauvia lips. Three-dimensional animation image. You can appreciate the contour define and the new gentle volumization of the lip body. Another case with an animation. One more time, remember that any side effect can be corrected early with infiltrative hyaluronidase or mini-invasive surgical techniques. But you will not have this problem because during your daily activity you will respect the best injection technique for this area. Thank you for your attention.